I talk like this. Welcome to the Pearlii Podcast. Okay, we're back. Welcome to the Pearlii Podcast. My name is Kyle Turner, the founder of Pearlii. And today our guest is a private practice dentist from the Northern Territory, Australia, Dr Kaejenn Tchia. Thank you so much for your time.
Thank you for having me.
All right, one of the big questions. People think it's boring, but it's bloody interesting, tooth decay. You're going to help us learn what is tooth decay, how do we manage it, what are the risk factors, and what I care about is how do we prevent it, because it is preventable. Do you want to kick things off with just a brief description of tooth decay? What is it?
Absolutely. So tooth decay is or cavities in your teeth.
Yep.
The best way I can describe it is using a metaphor. I want you to think of basically your tooth like a brick wall. So your tooth or your enamel is made up of all this, a brick wall of all these minerals. And throughout the day, your tooth structure actually undergoes processes where some of the mineral gets leached out and some of the minerals get put back in. Now, the minerals actually get leached out usually through one process, and that's through exposure to some sort of acid. Now, that can come through the form outside the mouth through your diet, whether that's soft drinks or things with acidity in it. Mm-hmm. The other way, which is more common, is plaque that's coating on your teeth. What happens is it digests the sugars from your food, and then it actually releases an acid. And when that acid coats on the teeth, that then starts that process of getting that mineral content out of the teeth. Now, when you lose mineral off your tooth, it needs to be replaced. And the best way naturally it gets replaced is through your saliva. So that's one of the strong functions of saliva, where it has those minerals to add it back in. Now, throughout the process, you're getting some taken out and some put back in. So net in a balanced ecosystem, as we call it.
Yep.
You're always at a net zero. Your teeth are healthy. But what happens is when you start to have more acidic events happen to the tooth or more acidic exposures to the tooth, if you're starting to take more bricks out of that brick wall and not replacing those bricks back in, eventually you get a hole in your brick wall. Same thing with your tooth, you get a hole in your tooth, and that starts the decay process.
And how does the saliva replace those bricks? Is that a silly question?
No, not a silly question at all. So inbuilt into your saliva are a couple of key components. So obviously water is what keeps the mouth nice and wet, and helps to lubricate the mouth so we can chew, swallow, and speak. But also embedded in there are these things called buffers, which are basically enzymes in your mouth that help to actually cancel out some of the acids that come into your mouth. Within that as well, there are important minerals. So without getting too scientific, your enamel is made up of this thing called calcium hydroxyapatite. Really complex thing, but essentially it is a really strong structure. And what happens is it's always leaching some of those mineral contents out, but in your saliva, it has a supply of those free minerals within your saliva that when it touches the tooth, it adds it back on.
Okay. So why is sugar? Everyone knows about sugar causes tooth decay. Why is that so bad compared to other foods?
I think the reason why is because the plaque, their main source of food is sugar. So they don't like anything else but sugar. That's their one food source. And
plaque. Okay, wow.
Yeah, so the bugs on your teeth are what we're brushing off each and every single day. They only like one food in the world, and that's sugar. So the more we feed them that sugar, when they eat that, they express those acids in return. And when we don't control it, we start to get breakdown of teeth.
I didn't know that. I know plaques are a buildup of bacteria on the teeth. Is that, and there's millions and millions, maybe up to 1 billion different bacteria. But I did not know that they only eat sugar.
Yes, that's the one thing they love.
So, and that helps the bacteria grow, I imagine.
Absolutely. So what happens is the way in which the plaque bacteria grows is they kind of form communities on your teeth. So we call it a biofilm because essentially they have a protective, almost like a tent canopy over their community.
Yep.
And what we do when we brush, we actually brush all of the bugs away or brush that community away. If you don't brush your teeth effectively enough, what happens is it stays on your tooth. And just like how your tooth takes those minerals to create a stronger tooth or put those bricks back in the brick wall, sometimes that plaque community can actually take in those minerals instead And that's what forms tartar, or what we call calculus in the dental world.
All right. Well, I think you've summed up this incredibly concisely and beautifully. I love the analogies with the bricks. You've given me a really key takeaway. Bacteria only eat sugar. I love that. All right, have you got any other comments? Is there something you tell your patients quite often before we finish?
In terms of the risk factors, as you asked before, of tooth decay, it's all about how many times those sugars can actually come into contact with your teeth. So it's not just a question of how much sugar you have. I always tell my patients it's actually frequency, which is the most important thing. So how often are you exposing your teeth to sugar? Because I say to my patients, if you're it's worse to have a whole block of Cadbury chocolate throughout the entire day rather than just take a whole section of that block, enjoy it in that one sitting, drink some water to swish it through, and then don't come back to it until the next time you want to have a little bit of a sweet treat.
That's a great takeaway as well. Kaejenn, thank you so much for your time. You've absolutely nailed the brief. We wanted to know what is tooth decay, and I think our listeners can walk away from this podcast having a pretty good understanding. What are the risk factors? So I just say a big thank you before we sign off. Thank you very much.
My pleasure.
To our listeners, please stay tuned for the next Pearlii Podcast. They're released every Friday on our Instagram. And don't forget to download the Pearlii app and enjoy a free dental checkup. Thanks again, Kaejenn.